Hey y'all, welcome to Vetted and Vet Med, the podcast where two African American female veterinarians pull back the curtain on the life and the world of veterinary medicine. I'm Dr. Wilson.
And I'm Dr. Levy. Join us as we dive into real conversations about mental health, career transitions, work-life balance, and the unique experiences we face as Black women in veterinary medicine.
So go ahead, grab your stethoscope,
and get your favorite cup of coffee or wine, and let's get vetted in vet med. And the other thing I wanted to talk about too was preparing. So, now you have takeaways on picking out this pet and whether a pet is good for your lifestyle, but also when something is wrong with your pet and you have to bring them to the doctor, to the vet. I don't even know where to start on this. So, for one, please come with information. Come with information that, like, the history is just one of the most important things. Like, it is not just a series of questions. Like, be nice and kind to your receptionists and your technicians that are asking you these questions, because they are just they're doing their part, and they're also trying to put the pieces of this puzzle together. Like, this role as a veterinarian involves a high level of investigation.
Yeah.
Because
like Encyclopedia Brown, okay? Am I aging myself right now? Okay. Yeah. Yeah.
the dog, if the cats and the dogs, if the patients could speak, and things would be so much easier, and that is not the case. However, you are the one that this baby lives with, so you are the one that I would assume would have the most information about the pet.
I mean, I think it's probably really important to know how long this dog has been vomiting blood. It's Paquito, just a little bit. Maybe when did you change the diet? Because now, we're having explosive diarrhea. Or did the cat have a string toy ever?
Right.
Or do you not know? Okay, well, got some, plication on X-ray, so I'm trying to figure it out. You know what I mean? Then you ask me what's wrong. I'm missing some things.
Yes.
So I'm gonna do my best here.
Yes.
And I'm going to speculate and say, at some point, this was going on. Please, bear with me because I don't have all the pieces, because you're the owner.
Yes.
I can only see what I can see, and I can only go based off of what you tell me, whether it be the truth or not. And sometimes we got to dig through that truth, or that not hope find the truth, like our marijuana babies. So
yes. There is no shame, okay? Like, granted, I don't live in a state where that is allowed, okay? Unfortunately, where it's not legal, not allowed, but it's not legal here in Texas. However, I don't care. I don't care if you are partaking in that and your dog has also partaken in that as well. I just need to know. And I can tell by the signs and sometimes the smell. Like, if you coming in there smelling like weed, then and now your dog got some neurological issues, or they drooling, they walking and they falling to the side. Then I can only assume, one can only assume that this is the cause. But, and then, there
Look,
are tests.
I'm not the police.
But because not all clinics have like the drug test.
Yeah.
I personally have not worked at one that has had them, but there are some that do have them that'll test for like meth. I think it has marijuana on there, but I know for sure it has like meth or heroin on there. So
why your dog got meth and heroin though?
girl, now that's
Anyway.
wild. That's wild.
That's wild. Weed is one thing, baby. Get your dog got ice in the system.
Oh yeah. So that one, on the other stuff, then yeah, y'all both need some assistance. Yeah, y'all both need some help, and that's okay. But I don't care about that. I'm not gonna report you. Just if you can provide that information, it could probably save you some money too. Because now I'm gonna, based off the symptoms, I'm going to be adding, diagnostics or tests on there. But if you tell me, okay, this is what happens, then I may be more so focused on just supportive care. Like I'm gonna do supportive care regardless, but then I may not feel like we have to necessarily do all these other things because we know for a fact that it was because of the weed. And in some cases, huh?
Supportive care, and it's a difference between supportive care and now I think you should get an MRI.
Yeah, right, right. We need to send you for a referral to the neurologist, you know? So yeah, that information is helpful, just telling us what actually happened. And then I know in some cases you may not know, but I feel like I get a lot of I don't knows for it to actually be true. And also the people that you sending up there with your pet, like,
God.
um,
Cousins,
yes, because they
18.
don't be knowing
I'm just the
nothing.
grandma. I'm the 18-year-old nephew. Well, I know just as much as you do.
They don't know nothing. They just bringing the pets up there to, be seen, but they have no information. And in some cases, like the owner is out of town. So now your pet is here. We can't get in touch with you. It's one thing if you at work
They
or
on a cruise to
something.
the Caribbean.
They on a cruise, and now no one can get a hold of you. And Fluffy is at the hospital, looking like, what am I doing here? Why am I here? And the cousin or whoever that you had come up there, and these husbands. I love my husband. I try to whenever I have had to send him up there, which is very rare. I'm like I try to send them with as much information as possible because they don't be knowing. They don't be knowing. Yeah. Yeah. So I'm not opposed to having somebody come in your place because at the end of the day, the most important thing is taking care of the baby. But write a note, type a note, send a text message, an email, or something. Like you could even contact the clinic in advance. Like, hey, such and such is bringing Fluffy up there. These are all the symptoms. This is when it started. This is what we noticed. Or my caretaker noticed while I was gone this, and that. Some of them come up there and they be on point. They know what they're talking about. And even the owners, I mean, I've had no owners take really, really good notes, especially if they have a pet with like a chronic condition. They have notes on when the pet was fed, when they got water. I have had a lady, she knew the volume of water that she gave. She measured the water. So she knew the difference, like in the values from what was administered to what was consumed and wasn't consumed, the fees, she had the times, a whole chart for the bathroom times, everything. And if the pet vomited, like she just had a note of it all, and I just thought that was just A+. And she was like, it's really easy. And I'm like, I'm glad you think that, because if that's all you had to do, then sure, because she was an older woman, so like she was at home with her pet, and that was the only pet she had, and so that was her focus, and so she had the time, and I realized we don't all have the luxury of having that kind of time on our hands.
Guess what? In the morning, you let them dogs out. If you got a fence, you let them dogs out. You get them kids together. You make breakfast. You're doing all these things.
Right.
I don't know if Fluffy has diarrhea
I don't
because
know.
he's outside in the dark because it's dark outside when you let him out now. In the dark,
I
punching
know.
his life away like his stomach hurting, and I don't even know because I'm trying to put some school clothes together. That's it. So I get it.
Exactly. I get it. I get it. I do get that. And that's why I do think it's important to, spend the time that's necessary, because most of the time they don't realize it until maybe Fluffy has an accident inside the home. And, by that time, Fluffy done had.
Baby, his bowels are through. They're through. They're inflamed beyond recognition.
I've been having diarrhea for 2 weeks now. Like, let me go in the house and see if he noticed now.
Help me. Help me. Oh my God.
And so I do want to commend the owners that when they do see it, because I know that life be lifing. So I do commend the owners that when they do see stuff like that, that is like, okay, we need to go, ahead and take them in and do something about this. And it's different levels to that. It's the ones that do know all the moves, and it's like, okay, they throw up that one time in the morning, and then they already on the phone getting them into the bed off of that one time.
Yeah. 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 Have you tried? I don't know. We're coming. We're coming in. Okay. All right. See you in a minute.
And I don't want to shoot them. I don't want to shoot them down,
No.
because I understand the concern, especially if the dog has never vomited before.
Right.
In my mind, sometimes I'm like, it just happened the one time. Like, because for my own pet.
Yeah, baby. This Kato got a funny stomach. He's gone through some things. Okay.
Yes.
He's lost some weight. But I already
Yes.
know because you ate something you weren't supposed to because you're not
Right.
supposed to.
Yes.
So you gonna be all right. But of course, I have things
Yeah.
in my arsenal that are
Yes.
gonna be
Yes.
seen in the clinic too. So
Yeah.
that's gonna be completely different. Like I give him some stuff in his stomach, he gonna be all right.
Yeah.
So I hear you. That one just one time. Cause he do that. He do that for fun. He vomiting
Yes.
for fun. So
Yes.
I'm like, okay, we
Yeah,
can work.
and we're gonna work. Yeah, we gonna work it up and see. But so you have the different levels of that, where it's like, okay, they do one thing one time, and 5 minutes later they in the clinic doors already. Versus the ones where it's like they've been vomiting for months, and they've lost 10, 20 pounds. And they're like, I just, at that point, they're like, I just realized, they just lost all this weight. And I'm like, okay, but we've been vomiting for months.
I'm
That's the
sorry, it's
part
not.
I can't get. That's the part I can't get over. We've been vomiting for months. We've had diarrhea for months or for weeks. Like, you've known about it, and nothing has been done. Some of these are challenging because it's somebody who may have had diarrhea, and we're like actively trying to,
Yeah.
treat them and do things to help improve the diarrhea or resolve it. But for a pet that has had to suffer, or even with the skin issues, where it's like, okay, the skin, this has been going on for months.
Now Boo Boo is bald.
Bald and bleeding.
All head, scallywag, just all kinds of scratched up skin. I mean, got a hole in his back then because he been mutilating himself.
Right. And now we have a miracle has to be performed now. And that's the thing too, is okay, so now, we're here. We've had this issue for months, and we're here. It's not going to necessarily resolve in days. It's not going to be an overnight fix. Like,
No,
it
this
may
is
also take weeks and months to heal.
yeah,
And
yeah.
that's going to probably take multiple visits. So you're probably going to have to come back for a follow up. You know what I'm saying? These are realistic expectations that it's just not realistic in people's minds.
No, I mean that's why we laugh at them. But the one vomit people, the one
Yeah,
vomit one time person. That look, I ain't mad at you
I'm
because
not
you go
mad
down
at
that
you.
road. You go down that road, baby. Sometimes it ain't no coming back from it.
Yeah.
So come on in, come on.
Come on in. Go to your follow-ups to make sure that it's healing appropriately. And if
Check.
it's not, yeah, go to your rechecks. And if it's not healing well, you don't have to wait till your recheck. Like, if we're not getting better if you don't see improvements or progression over the next few days, like something, it's not going to necessarily be healed. But if we're not going in the right direction and your recheck is not till a week or 2 weeks from now,
Right.
you need to call the clinic, call them. I get a lot of people that will come to me after an issue started at another clinic. They never went back for their recheck or things, so things probably didn't get better or it went away and came back, but they never went back to the previous vet. They just decide, I'm gonna just go somewhere else. I'm gonna go to a new vet. And it's like, okay, then they come and
Starting
they
over.
we starting over, especially if you ain't got no records with you. If you don't have no records from the previous vet, and this is a long, ongoing situation, I'm gonna have to start over from scratch. Like I'm gonna probably have to do the same test that they already did, and I would like to not necessarily have to use the same medication because if it didn't work, I would like to try to find something better, that works for your pet. Like that's why keeping records is really important. Keeping all that stuff together. I'm like, think about your own health.
Get you a little folder and
Yeah,
put all
get
that.
a folder and put the medical records together. Yeah, especially if you have a sickly dog. There's no bank that we can go to, no medical bank that we can go to get the records from your pet. So, if you don't, some of them don't even know the name of the clinic that
Yeah, the one
they
down on. I don't know anything about this place.
So keep up with the medical records and have real expectations because now I'm going to have to treat, something that somebody else started, like treating. And if it didn't get better, go back. And if you want to go to somewhere else because maybe you didn't have a good experience, then that's perfectly fine. But I do think that, seeing things through is beneficial. And like I said, if it don't get better, don't wait till the recheck because it's gonna be worse.
Yeah. Yeah.
My goodness.
Yeah. Then that's also, lessons learned. They don't know any better in that moment, but listen, we'll do better.
But yeah, so just to get off of my little rant, I can say that it will be helpful. And this is one of the things that I wanted to have in the book that I was talking to you about, in regards to helping prepare pet parents. Because I'm very passionate about educating them so that they can be better advocates for themselves and for their pets. And so this was not necessarily to bash, but it was a venting session. And it's meant to just kind of share the perspective
Yeah.
that we have and how you can better help us because if you can help us, we can help you, more efficiently. So definitely having a timeline of when symptoms have occurred is helpful. The frequency, how often something has happened, and it gives us a better idea of if this is something that's chronic, that's been going on for a long time, or if it just started,
Or if it's related to something else, or if it's actually something new.
yeah, changes in your lifestyle, changes in
Good.
diet, changes in treats. If other people in the household are feeding the pets
The
that you
older
may
person
not,
in the household that may have
that's that drop something, whether it was food or medication, making sure you keep your stuff locked up and separate your medication separate from your pet's medications, and then being mindful of, right, if those things may have fallen on the floor, because I definitely know I've experienced those type of situations where a owner may have dropped their medication and the dog hurried up and came and ate it.
right.
And so knowing what that medication is also helpful because then we can look up possible side effects for those particular medications that your pet could possibly have or endure. So all of that information, like we're not just asking questions, because I see people get so annoyed when they get asked all these questions, but it's not for fun. Like it is us trying to put these pieces together to make sense of things. We do not know everything, and that's why the history and the information that you can provide as the pet owner is essential. So.
And I think we know everything. I appreciate it. You know, to know a lot, but for real, I just think it's important to understand that we're people just like everybody else, and we have to scenario just like Davida was talking. Sorry, Dr. Levy was talking about earlier. You just got to be cognizant of the information that you're given because, again, we're doing it based off of what you tell us and what we put the pieces of the puzzle together. And if you come across a person like me, I'm not going to care about you getting an attitude about the questions that we're asking.
Mm-hmm.
Directly explain to you through your attitude because I'm sensing it. I have bedside manner, but I also am a person. I'm not going to, let that control this environment.
Yeah.
Be upset,
Mm-hmm.
but I'm going to take care of your pet. So it just says what it is. Like that.
Well, I think we drugged that one. I'm sure there's other things that we can talk about in regards to that, but I think that one was drugged. No.
Big fish trying to drag that one out the sea. It's okay. Okay. It's
And
okay. It's
I
bad.
hope right. I hope that was helpful. I hope it was helpful for somebody.
Yeah.
Okay. Well,
Thank y'all.
we'll conclude this one, and we'll see y'all next time.